Assalamu alaikum wa rahmatullah. Welcome everyone to our course, Basics of Publication in Healthcare Research. My name is Rani Mantari and I'm going to be your first lecturer for today. And the first topic that we'll be discussing is the ethical consideration in healthcare publication. So first of all, in order to understand the ethics that involve the publication of any healthcare research, we need to take a brief introduction into research and its processes. So the literal definition of research is an investigation that is undertaken in order to discover a new fact or get additional information. But scientifically, it means the systematic collection, analysis, and interpretation of data to answer a certain question or solve a problem. For example, if we have a particular problem with understanding the causes of hypertension, then we will conduct the research to understand or solve the problem and how it can develop or occur. And there are criteria which the research process should meet in order to be called a successful or a scientifically valid research. These include having objectivity, meaning that the research is not personal affair, but should be free from any personal interpretation or bias. And it should also be having verifiability, meaning that it should be clear how the investigation was carried out and how the results of and the conclusion were even arrived at. And it should also have openness. This includes and accessibility. This includes the research method that was used and the knowledge that was acquired and any necessary information that is needed to meet the required criteria. So the characteristic of the research is that it should be a clear statement of the problem. Also, it should require a plan and builds on existing data while collecting new data and new information. And there are two main types of research. These include the fundamental and the practical type of research. In the fundamental, this is the pure explanatory or basic type of research. This involves the generation of new knowledge and technologies to deal with major unresolved problems. Also, there is the practical, the applied policy-oriented or action-oriented type. This is the one that starts with a practical problem or a question and then seek the result of the research that is being capable of immediate use or immediate application in these problems. So there are many types of research that we can include in our project, but this will depend upon the problem that we are seeking to explain. So the characteristic of a successful research should have activity and involvement, meaning that it should have good and frequent contact with both out and in the field and with colleagues as well. It should have no expedience, meaning that it wasn't just undertaking because it was easy or cheap or even quick, but it should have actual scientific value. There is also the intuition, feeling that this work is actually important and can make a difference in patient's life or in the community health in general. In addition to the theory concerning for the theoretical understanding of the research project and real-world value, with problem arising from the field and leading to useful ideas creation and this type of information that is to be used. So the first step to conduct a research project is to have a defined research problem. A research project starts with a problem or a question. Therefore, the problem is the discrepancy between what is and what should be and what is actually exists. So a well-defined problem leads to a good statement of research question, hypothesis, and methodology. So it is the first step in order to create a good research project. So which problem should be given the priority when we are conducting a research? This includes the problem that is relevant. Also, it should avoid any repetition. It should have feasible in terms of time and cost, and whether this is to be achievable or not. Also, it should be politically acceptable, applicable in that the recommendation could be stated from it. If it was urgent, then this needs to be conducted immediately. Also, the ethically accepted, which couldn't be ethically acceptable, then this problem shouldn't be investigated. So for the analysis of the problem, this focuses on two main issues. The first one is identifying the factors that may have contributed to the problem, and this is known as the contributing factors. And these factors could be grouped into three main categories, including the sociocultural, such as age, education, and social class or belief. There is also the service-related factors, and such as the facilities and resources. There is also the disease-related factors, such as chronic heart disease, hypertension, and therefore we should, for the two issues, state the association between each of these factors and the problem. This is the problem analysis diagram, which can be helpful in analyzing the problem and discovering which factors are actually associated with these problems and how it can be solved. So when we are defining the problem, certain issues need to be considered. These include the incidents, which are the observations of an event. Usually, this is the first clinical sign of a disease. Also, the prevalence, recording of the presence or absence of a disease at a point of time. In addition to the geographical areas that are affected, the characteristic of the population group, and probable reasons for the problems, as well as possible solution and unanswered questions in this area or in this issue. So after stating the problem, we state the research title. So after the problem has been defined and all point has been taken into consideration, then the research title should be clear to be formulated. So it shouldn't exceed 2 lines, and it should include the population, such as females or males, adults or children, as well as the area in which the research was carried, the time scale. So in other words, it should be aim specific, place specific, and time specific. So following defining the research title, we should conduct our literature review. So literature review, we do it to support the argument or the need for the research. In other words, to give a reason why the topic is of sufficient importance for it to be researched. Also to provide the reader with a brief up-to-date account and discussion on the issues that are relevant to the topic. Uh, Also to provide the reader with discussing relevant research that is carried out on the same topic or similar topic as well, and to prevent any repetition and duplication of the same work that has already been conducted. Also, we conduct literature review to support or define the statement of the problem, as well as to determine a suitable type of methodology and outline any criteria or problems and topics that need for the research in this particular area, as well as to have a use of appropriate recent literature review about other works in the field. And when we are conducting literature review, we should start in a systematic way by defining the topic, the causes, the studies, and why is there a need to study this topic. Also, the sources that are referred to should be relevant to the problem, and literature review should include a range of written sources, such as articles and textbooks, and studies included should be the ones that were actually read by the researcher, meaning that it should be conducted with honesty. So there are many sources of information that we can include in our studies. These can include community articles or provenance level access, uh, such as clinic, hospitals, opinion surveys, belief, annual report, any type of this information. Also, we can obtain information at a national level, such as articles from national books, as well as previous research in the university, for example, and this type of inclusion criteria. There is also sources of information from an international level. This can include information from WHO, internet sources. So in general, the source of information could be from individuals or group or even organizations. And these information could be from published source such as book articles or over the internet, or it can be from an unpublished source, uh, such as report, previous unpublished thesis, and this type of information. And after citing or choosing the source of information, we need to state these information that we have used in what something that is known as a reference or reference list. And to generate these reference lists, we have many different forms. These can include books such as the Vancouver style or even the Harvard style, and these are examples. The journal articles, we could also list them in Vancouver or Harvard style as well, and all of these can be helpful. And also, if we are using sources over the internet, then we can as well cite them, but we will need to include the reference in the URL in the reference list. And after this, we need to state the research objectives. These include summarization what to be achieved by the study, such as answering the main questions of what, where, and why. Also, we need to specify the questions to be answered and help to focus the study. Also, avoid the collection of any unnecessary data and organize the study in defined parts or phases as well. And when we are writing the objective, we need to follow the SMART guidelines or criteria. These include having specific objectives that to make the study focused. Also to have measurable, possible to be measured with sufficient accuracy. Also, it should be achievable, that it can be done, and realistic or relevant in terms of cost-wise, and it needs to be timely within a reasonable time scale as well. And there are different types of objectives. They are mainly the general and the specific objective. In the general objectives, this is the principal objective that must be stated, and questions that have already been asked and answered, which are clear from the literature, should be avoided. So it is usually obtained from the research title, and they are usually written in general terms with being realistic and clearly stated, and they should cover the problems and factors or variables that are under study. So following the general objective, we have what is known as the specific objectives. This is the breakdown of the general one into a smaller logical part, since it is impossible to use one single question to answer the research problem. So each objective needs to be assessed by the collection method tools that were chosen and to determine their actual relevance to the chosen factor or chosen research. So when we are writing these objectives, we need to start with terms such as to, and use terms to assess to determine, which are actually can be measured. And we should avoid terms such as to know, to understand, and to see, since these cannot be measured. And they most importantly should be related to the title of the study. So following stating the research objective, we need to state the research hypothesis. So a researcher conducting a study usually has a theory in mind. And the hypothesis is a research question which fits into a particular program of testing, and it is a statement which predicts the occurrence in a certain condition based upon a theoretical concern. So this can actually predict or navigate the null hypothesis, and therefore can be assessed from it. So there are also 4 conditions that a hypothesis should meet, including that it should be logically consistent, as it must not predict the results which are inherently contradictory. Also, the hypothesis should be stated as simply as possible. and the prediction from the hypothesis must be verifiable. And if they are not, then the hypothesis cannot be tested. So a hypothesis must be related to a matter which can be clearly defined in terms of factors associated with the problems, for example. So for the research methodology, it has some variables, which is a quality or characteristics, or even constituent of an individual, which is changeable and even measurable, and as such can take different values. And there are different types of variables as well. These include the dependent variables, in which these are the ones that are used to describe or even measure a problem under the study, such as, for example, serum cholesterol level of a study of chronic hypertension. There is also the independent variable, and this type is the variable that is used to describe or even measure the factors that are assumed to cause or influence the problem as well. There is also the confounding variables. These are the variables that are associated with the problem and include, for example, the outcome and the possible cause of the problem, which is the exposure. And there is also the background variable, which include demographic characteristics such as age and gender, as well as the information such as religion, employment status, or social status, all of which can be included. So in general, a variable can either be a qualitative or a categorical or even quantitative variable. In the qualitative one, these are the variables that cannot be measured in figures, and they are either nominal or ordinal type of variable. In the nominal variables, these can include names, and they are not measured by simply counting, and they often consist of unordered either or type of observation. And this case, they are called binary variables. So, for example, binary nominal variables can include dead or alive, male or female, pregnant or non-pregnant. So this is as simple as one or none. Also, there is the numerical variable or the quantitative one. These are the variables that are measured as quantities, and then they can be numerical discrete, such as data consisting of count without fractions, such as number of previous pregnancies or previous babies born to a certain number of females. There is also the continuous variables that could be converted into nominal variables, such as the systolic blood pressure can either be above 90 or less than 90, and therefore it can be converted. So some general terminologies that we can use in conducting research, healthcare, and its publication is data, which are the observations that is made on individuals constituting the study. There is also the quantitative data that are based on numbers. There is also the qualitative one, which are based on numbers but categories of skills. There is also the parameters, which are quantities used to describe the characteristic of such population, as well as the validity, which is concerned with whether the instrument is actually measuring what it's supposed to and whether the information we obtained is actually accurate or not. There is also a term which is known as the internal validity. This is the one that relates to the information obtained from the subject in the study in terms of being valid. There is also the external validity or generalizability, and these are the ones that relate to the information obtained or relating to these factors as well. And the reproducibility or repeatability, which is concerned with the instrument will produce the same results when administered repeatedly or not. And the verifiability, which is the quality and the characteristic constituting this type of research. There is also a term known as morbidity, which is any departure or a state of physiological or psychological well-being from mortality to death. So the exposure can include describing factors or variables or measures in which the person or group of people come into contact with, such as smoking variables. So after determining all of these factors, we need to choose the most appropriate study design. So according to the kind of the problem, the information that is already available to us about the problem and the resources that are available, then the study type can actually be selected. And there are two types of studies, the observational and the experimental studies. In the observational studies, these are the non-interventional studies. It can include cohort study, follow-up, longitudinal studies, cross-sectional ones, case control studies. While in the experimental type, these can include the interventional studies, such as community trials or the community level interventions. So in the observational studies, the most common type is the cohort study that is used to describe those born during a particular year and then followed into the future to assess whether the occurrence or prevalence of a certain problem actually exists. So it could also be used to describe any group of persons who are followed over a period of time. And cohort studies could be prospective study in which a defined population can be identified who have been exposed or will be exposed to a certain problem. So in the cohort study, they observe the progress of individuals over a period of time, and they study proceed from cause to effect as well. In addition to, they help to determine any causal relationship, whether it actually exists or not. So it demands time and resources as the most common issue relating to cohort study. Otherwise, they are regarded as the best type of studies to detect actually whether there is a problem or not. So they can have long follow-up periods, and mortality within these groups can develop. Therefore, this can be regarded as an issue that can face cohort studies. So a study may follow up two groups of subjects, one group exposed to a risk factor and the other is not, to see if the exposure influenced the occurrence, such as the disease, such as cancer, and the results are represented in incident rate or relative risk incident as well. So the other type of cohort study is retrospective studies, in which one group of subjects are identified in the past and then followed up from that up to a certain point in the future. So overall, cohort studies require a large sample size and long follow-up periods. So following the cohort studies, the other type is the observational study. And in this type, we can have the cross-sectional studies, and they are the simplest form of epidemiological studies. They are investigating the relationship at a single point in time, and they are unable to provide evidence of causality for this future retrospective or prospective studies are most often chosen. And there are generally three general forms of relationship that might be looked at in a cross-sectional study. These include the differences between groups in the level of some variables, or the differences between groups in the rate of a certain condition as well. Also, it can assess the association or correlation between two variables in the sample, and it could be used to identify how many people in a given population possess a particular disease, opinion, or whatever data we are looking to understand. It can also have descriptive studies that involving the systematic collection and presentation of these data as well. So they can also be used to explore the aspect of a situation, or even to seek explanation, as well as provide data for testing a hypothesis. So it is very important to choose a representative, non-biased sample in this type, and they need to have large sample size and description in time and of place and people as well. Also, there is the case control studies, and in order to investigate the causality in epidemiological studies, it is important to include element of relating to the cause as well as to the effect. So this is considered less expensive and work backward in time from the effect to the cause than other type of studies. And they start with the identification of a person with a disease or other outcome variables of interest and a suitable control reference group of people without the disease. So the cases with the disease are identified as the effect and the controls are obtained to compare them with them. So the exposure of the cases and controls to the factors under the study are then compared, and if the exposures are sufficiently different, then this is supporting the case for a causal link or a causal association in this type of study. So the control can then be sampled from a suitable non-diseased population, leading to an unmatched design. And it is not correct to require that the control group be alike in every aspect of the study. So the major difficulty in such studies is that the selection of a suitable control group needs to be regarded or considered in these factors. Also, they are usually easy to carry, rapid and inexpensive as well, and require fewer subjects compared to other type of study. While the case control studies are not considered suitable for the evaluation of therapy, the cases and controls cannot be representative of the whole population as well. So this needs to be taken into consideration when we are choosing these factors. While in the experimental studies, this is the basis of all experimental study, is that the effect of a treatment on an outcome must be compared with the effect of the control treatment on an outcome as well. So they are assigned to the subject by the investigator, and then the intervention is assessed to determine which factors can actually contribute to the problem. And some of the terminologies used in experimental studies can include community trials or field trials, as well as these factors that are actually assessed in them. So in both the community trials and the interventional studies, assess the exposure and the outcome that are measured at less controlled conditions, as well as answering the question of does the treatment work in practice under day-to-day variation. And the major objectives is to assess the factors which have the implementations of the problem as well. So in clinical trials, these are individual-based trials used when the subject has a defined clinical status and may have additional exclusion criteria depending upon the study that is to be conducted. So some of the general consideration in experimental study is the selection of the study population, as the problem, if they are lost due to follow-up and as such will affect the sample size of the study as well as the power of the study after that. Also, the allocation of treatment program should be random in each group, and the length of the observation could be minutes, week, or even months or years, depending upon the study in which we are looking to investigate. Also, we should be aware of the observer effect, and ideally this should be blinded to the group and should have practicality of the participant effect and monitoring for them. And the outcome needs to be measured at baseline and then after the treatment to assess for the presence of any changes. And for the study population, we need to select one that is actually representative of the problem and can assess whether this condition develop or not. And to produce a workable number of subjects, some form of sampling procedure is needed to assess for these factors as well. And then the sample is taken from the study population to provide estimate of the population parameter, and it is normal practice to make the sample representative of the population from which it was drawn. And the sample size is the number of individuals in the sample that need to be included in order to produce a workable number of criteria that can actually be assessed or measured within these samples or practical practices in this area. So sampling is the selection of a population or a number of units in the study that can be selected to determine the most prevalent or the best power in the study. And sampling methods have two major methods that include or category, which are the probability sampling method, as well as the simple random sampling that can be included as well.